in particular kind of asked like a more specific question, and then it kind of just related to being a new grad nurse. And she said, why don't you talk about things that they don't teach in nursing school that you encounter as a new grad? And I was like, ooh. For me, that is a touchy question because I started in a specialty, so there's a lot of stuff that we touched on in nursing school, but I didn't really grasp that before becoming a healthcare. And it's been a big learning curve. So, but not a hard one because it's postpartum. I know when I go to LP, it'll be a huge learning curve. So, stay tuned for that and all the tears and stress. But there are some things that as a student nurse, you just will never do or know how to do or experience until you are a full-fledged licensed big girl. So, let's jump into it. The first thing I put, I have a list, so if you see me looking down, I have a list. Puffy eyes, red eyes, I took it to a first thing, charting and patient care. My nursing school, this is not every nursing school because I've talked to people I work with who've gone to other nursing schools. But my nursing school, I had the privilege of charting with the system Cerner that I chart with now at work. And so I came into this job knowing how to use Cerner, which is a huge advantage. Learning how to use the charting system that you have to work with can really make transitioning as a new nurse so difficult. So if you have a chance in clinical, because there are things about Cerner I didn't even know about until I started working. And I had used Cerner for pretty much all of my clinicals. So if you're a student nurse and you have your hands on Epic or Cerner, whatever you feel like you might chart with in the future, learn it so well, because that really made a huge difference in making being a new grad nurse a lot easier transition for me. But like I said, there's certain parts of charting that you don't know how to do. Like, I had never collected a lab specimen on my own. I had to learn that. You have to like print out a label, scan the patient, scan the lab specimen thing in the chart, and then have a little mini printer next to the computer that automatically like Bluetooth prints it out. Prints out a label after you scan the patient and say that you collected the specimen. It's just crazy. Also, putting in orders for physicians. I'm kind of jumping ahead right now, but let's just jump ahead. I've never had to call doctors so much. I called one nurse practitioner in school. That was it. And I was like shaking, and I'm like, it's a nurse practitioner, but I was like shaking, and my voice cracked, and I was so scared. And then I like went up and talked to like one doctor in nursing school, and he was very nice. But that was it. So I know how to use SBAR. I know how to do all those things. So the first couple times I called a doctor on my job, I would write down my SBAR and have it ready, go through it, and then bam. And what I've really gotten good at is learning certain OBGYNs, which calling OBGYNs is different than calling pediatricians. See, I have to call OBGYNs and pediatricians because I have moms and babies. Before, calling a pediatrician wasn't very fun because they're used to just working at their office and coming in during the daytime whenever they want. They don't like being woken up because they're not used to being at the hospital late hours. OBGYNs are a little bit more understanding. Pediatricians, not so much. So I'd be calling, I'm like, this baby has a TSB of 10, 7, 8. It's higher than me. I don't care. Click. But the policy and the orders say that I have to call you. So now we have hospitalists who cover pretty much all of our pediatricians, and we can call them and they're there all night, and it's wonderful, but also hard because they're very different than what our normal pediatricians do. That's a whole nother vlog that we'll get into. But calling doctors, I was prepared for it, but I didn't know that you have to call them, do your SBAR, they will give you orders that now, not every hospital does this, but this is my hospital. This is the normal for my hospital, especially labor and delivery and postpartum. Give you orders. You read back the orders. Like, are you sure you said, especially with narcos? Oh my gosh, you guys, just be so careful with your narcotics and be so vigilant that you are tracking everything. You're reassessing pain after giving a narcotic, any narcotic, and that when you do your count back, it is correct, and that when you scan your medication and you refresh the MAR after you sign off on your medications, that narcotic is in there, and it says that you gave how many narcotics you pulled out. If you pulled out 2 tabs, look and make sure you gave 2 tabs, because right when I got hired, they had like fired 12 people for narcotic stuff, just not being thorough with their charting and all that. And of course, not all 12 people were stealing narcotics. Maybe not even one person was, but their charting was inconsistent and not complete, and they got fired because they didn't want, the whole opioid epidemic. So that's another bunny trail. But be very careful with your narcotics. Calling MDs, I was not used to that when I became a nurse. Putting in orders for doctors. I do not let them hang up the phone until I have read it back at least twice and written it down. When you call a doctor, write the time down, real time, that you're talking to them. Write down the order that they say. Read it back to them. Say, that's what you want. 5, Norco 5, 325, PRN, Q4 for 2 tabs for 7 out of 10 pain. Yes, that's what I want. Okay. Sometimes I even type it in as I'm talking to them, like on the computer. But mainly I write it down, read it back to them, and then I don't know how it is with other charting, but with Cerner, there's a part in the chart where you go to clinician notification. You type in the clinician that you talk to. I do this with doctors, CRNAs, the anesthesiologist, anybody who is higher up than me, who is a practitioner, physician, something like that. I do this. You write in their name, the real time, that time you wrote down when you talked to them, the real time that you talked to them, and then a detailed explanation about why you called and what they ordered. Called the doctor because patient's 8 out of 10 pain from cramping. She didn't have an Norco or any strong pain medication ordered. Requested Norco. This is what put down. Doctor ordered 5, 325 milligrams of Norco, 2 tabs, PRN, Q4, the exact order. Write that down. No other orders given. Bam, you're covered. That way, in the future, or if anything goes wrong, you can't say, I got squirrely and just did something as a nurse that I'm not licensed to do. You can say, no, I called the doctor. Here's my order. Here's my charting. And that way the doctor can't be like, oh, I didn't order that. Well, I documented that you did. And the system that we use, Perfect Serve, that calls the doctors, records. It doesn't record the conversation, but it records like the time. It timestamps when you call the doctor. So if they pulled those phone logs, they would be able to see that, oh, she did call them at this time, and blah, blah, blah. Cover yourself. As a nurse, cover yourself, because these people ain't loyal. When it's you on the line or them on the line, they ain't going to choose you. They're going to choose themselves, because they went to school for a long time, too, to get that license. So, cold world. I know. Cold world. Another thing, time management. Say it with me, folks. Time management. As a new nurse, time management is going to be your biggest skill set that you build and need, because you can know all the things. You can be the smartest nurse on the floor. And I'm sure you are. And you could have passed nursing school with A's and just been the smartest student. But if you become a legit nurse and you get a job as a nurse and you get on a nursing floor and you have no time management skills, you're done. You are done. Like, you're not going to make it. So, my preceptor, and I had a professor in nursing school, shout out to Professor Bartow, who one day was looking at my worksheet, your brain that you use. If you're in nursing school, you're a nurse, you understand what I mean by that. And he was like, where's your timeline? Where's where's your timeline today? And I was like, oh, I'm going to try and work on like not having a timeline written out because I want to be more like self-sufficient and I have a checklist. Like I don't need a timeline. He's like, no, Allison, you need a timeline and you need every hour scheduled out because if you don't, you will get off track. And boy, was he right. So that's something my preceptor taught me. The best thing she taught me, here's when we do this. So let's just say mom and babies, if I'm just going to go with a really easy example. If a mom had a fresh C-section and it's been under 24 hours since her operation and the baby's under 24 hours, then we check on both of them every 4 hours. So I start my shift at 1900, 7 o'clock. So at 1900, 4 hours later, it's 11 p.m., 2300. 4 hours later, it's 3 a.m. Okay? I'm going to plan everything I can around those time intervals so that I can cluster my care and I don't have to be in the room all night. Some medications, because you can only give them in certain time frames, you can schedule it to where that's like around your 2 hour, because on nights, you round every 2 hours after midnight. You're not rounding every hour. People just hate you. If they don't hate you already for trying to come in every 2 hours, which you can also plan your night to where you're coming in for something actually, not just like, hey, how you guys doing? You're coming in to actually do something. So, time management. Learn how to make a list and be like, okay, this kind of document is due at this time, because we have like PKUs for babies are due when they're 24 hours. So I can be like, okay, this baby turns 24 hours at this time. Can I assess them and give a mom a medication and do their TCB, which is the test for jaundice that we do at 24 hours, to know if they need a TSB. Like, you see where I'm going with this? Cluster your care by getting a report on your patient. Sit down for like 5-10 minutes after report. Look at your meds. Look at what's due that night. And make a timeline for the night for every patient. It's going to save you so much, especially if you're in med surg. You got 5 patients. You do not have... You don't have the brain enough to be like, oh, I'll manage my time in my head. No. Managing it on paper, as a new nurse, is going to save you. I think later down the road, it can help. But I was with a preceptor who she's been in postpartum for 5 years, and she still uses this timeline, and it's so helpful. Also, I highlight everything that's charted. If it's on my sheet and it's not highlighted, it wasn't charted. So I go back and make sure it's charted. Pro tip. Another pro tip. My worksheet looks kind of crazy by the end of the shift, but I know that everything's charted. So, all these little tips and tricks you can do to make your night successful and to make sure that you're covered and that everything's charted and that everything's done. Just learn these little tips and tricks because they will save you as a new nurse. Because if you manage your time well, then you have time to think critically. Then you have time to start putting the pieces together. You have time to understand what you're doing while you're doing it and why you're doing it. And look at your patient's vital signs and be like, is that off? Is it not? Look at your baby at the beginning of your night and be like, whew, they're breathing kind of fast. And to Kipnick, I got to call the doctor now. But I made my timeline, so I know that I have time to do this and I don't have to stress out about my other 3 patients, because you see where I'm going with this. Just time management. Oh, how to learn with certain personalities and other people. When you're a nurse, you have to deal with the doctor, other nurses, the lab tech, the EVS workers, everybody you gotta get along with. Also, calling doctors, you also have to call everybody else. If you need something for lab, you're calling lab. No one's calling them for you. You're not going up to another nurse and be like, can you call lab for me? Because I'm a student. Wait, I'm not a student anymore. You're calling lab. You're calling EVS. You're calling pharmacy. You are managing that patient care, because guess what? Ain't nobody going to do it for your patient except for you, unless you have a really good resource nurse and charge nurse. But there are limits to what they should be doing for you. Remember that. There's limits. Do not be afraid to ask for help. But don't be like, hi, I need help with everything. Give all my meds, give all this, because I have no idea what I'm doing. No. Be self-sufficient enough to where if your charge nurse and your resource nurse are busy, you can still do it. Pro tip number, I don't know. I keep going off on bunny trails. You have to, okay, back to this dealing with certain situations and personalities. Oh boy. I get along pretty much with every one of my coworkers. I don't necessarily prefer some people's personalities. The majority of people I work with, I love. But there are some personalities that I don't get along with. So how do you deal with that and stay professional? Stay objective. Don't take anything personal. Even if they might be being personal, they probably aren't. It's probably something outside of work causing them to be mean, to say something in a certain tone, to ask for something in a certain tone, to say, well, you can do it. Maybe they're pushing you to grow as a new nurse. I don't know. As long as they're not bullying you and you're not being harassed, don't take everything personally. Okay, you guys? You will just worry yourself sick if you take things personally all the time. If I took things personally, I would hate half the people that I work with. Because sometimes in the moment, I even do this, and I hate myself for it sometimes, but you need something or you're busy and someone asks you a question, you're like, what? And your assertive, nurse side comes out. And you, in the moment, you're kind of brusque and you're like, okay, I need this now. Or this is, my patient needs this now. Or you're worried about a patient, so you're kind of brusque about a situation or whatever it is. And in the moment, you didn't mean it towards that person. You didn't mean to be rude towards that person, but they may take it that way. And they may do the same thing to you later on. So don't take things personally. Be objective about every situation. And then if it's a situation where you feel like you need to talk to the person, be respectful. Don't be emotional. If you have to take 5 minutes to step aside, take a deep breath. Say, okay, I'm not going to be emotional about this. I'm going to be a responsible, mature adult. And if they act differently and they act nasty and mean, then that's on them. You did your best, but be objective. Don't make your work life harder than it has to be. But don't get bullied. Don't deal with that. And then I say the last thing that as a student nurse, you cannot prepare for, being a real nurse is the adjustment to your life. I work night shifts, so huge life adjustment, huge change in my just overall lifestyle. I feel like all I do is sleep. I feel like I always look like a vampire, but it's worth it because I like night shift. I like the night shift crew. I like getting paid a little bit extra to not do the same kind of work day shift does. That doesn't mean I'm not lazy on nights. That doesn't mean we don't have stuff to do, but it's just a different workflow. And I prefer the workflow on nights to days. Just know that even though you're working 3 days a week, if you work 12s, especially if you work night shift, it's a huge life adjustment. And on your days off, just really enjoy yourself. Clean your house, make sure it's tidy, maybe the day before you go to work, so that on your day off, you can just enjoy it. Because I guarantee you, if you work night shift, you are gonna waste a lot of your days sleeping, and try not to do that. This new thing I've been doing is so that I'm not sleeping all day on my day off, or if I have one day off in between 2 days of work, is that I will try to stay up as late as possible, maybe till 10 or 11 after a shift, and then sleep only 4 hours, and then get up and do more stuff with my day, because I find that I feel really productive. I do some stuff when I get home, stay up till 10 or 11, and then I take a 4-hour nap, and then I wake up and I'm able to eat dinner with my husband. I'm able to kind of hang because I took a nap. Just figure out what works for you for night shift and even day shift. And just know that even though you're a nurse now, you're only working 3 days a week and you're making money, it's a huge change. I didn't really prepare myself for how big of a change it is, even from just being a student. I was so busy as a student, but there's sometimes I feel like I'm more busy as a working nurse than I was as a student, surprisingly. So just be mentally prepared for that adjustment, work your life around it, prepare your family and friends. But also know that if you work at a great place like I do, you get your schedule 2-3 months in advance. Shout out to my manager. Then you can really plan your life too. So there's so many perks to having a real legit life career. Some perks of having a nursing career: you get great benefits. I got a great retirement plan in the works. I have great health insurance now, and I actually went to the dentist for the first time in 4 years. Shout out to all those young married couples who are just trying to get through school and can't afford dental insurance. Oof. Guys, I have 4 cavities. I'm so not happy about that. That's from drinking all those sugary coffee drinks before I went keto during nursing school. I know that's what it was from. I get like discounts through this thing called Tickets at Work through my job. I have union benefits. I have union reps. I get raises like every 6 months for the next like 3 years. I get a pay bump when I get my BSN. Just all these cool things that you're like, whoa, I'm an adult now when you get a job as a nurse. So that's a cool thing too. But just know you're gonna have major life scheduling adjustments. And don't be scared. Just learn how to reschedule your life. I now have a calendar. I never had a calendar before that schedules out my work schedule for my husband and his school schedule and my new school schedule now that I'm start doing my BSN again. It'll be done in February. Whoop, whoop. So yeah, huge life adjustments. Here's my real quick, because I want to keep this video like try to keep it under 20 minutes, but you know, anyways, if you're done watching, you can just sign off. But night shift, here's how I do it. My schedule is I work Monday, Tuesdays, off Wednesday, on Thursday, and then I'm off usually till Sunday. And then I work Sunday. I'm off Monday through Thursday. Hallelujah. I love those weeks. And then Friday, Saturday. So how I do it, on my first night on, let's just say Monday, I sleep normal, whatever. I just wake up at a normal time. If I wake up a little early, then later on in the day, I'll take an hour nap before work. Wake up at a normal time, go to work, sleep all day, go to work. Get off work Tuesday, try to stay awake as late as I can Wednesday, do the dishes when I get home, do some laundry, go to bed around 9, 10, wake up at around 2 or 3, spend all night with my husband, go to bed usually at like midnight, 11 midnight, and then wake up for a normal day, do some stuff, take a nap before work, go to work. And then to reset myself, I come home after work, stay up until like at least 10, take a nap from 10 to 11, 12, 1, 2, and then there you go. It's a little hard. Sometimes you wake up in the middle of the night with insomnia. I've been taking melatonin for the insomnia. It may help you. It gives me weird dreams though sometimes, so disclaimer there. Find what sleep aid works for you that's healthy and, you know, safe to take. And yeah, being a nurse is awesome. If you're a nursing student right now, it is so worth it. You might struggle. Not everybody gets in a nursing position like I did. I got into postpartum. I'm very lucky, very grateful. But if you're struggling, just get that year of experience and go somewhere where you are going to be passionate and happy and grow even more as a new nurse. So hang in there, learn your time management, learn how to call people, get those phone lists, write those numbers down, learn your charting, learn how to deal with people objectively on the job and not make enemies, make friends of everyone, even if you don't really like their personality. Just be kind and be friendly to everyone you work with. And get ready for those life adjustments of being a nurse. It's awesome. I love it. All right, guys. Good night. I'm going to go to work.